this is Jen and Ikina on eyesurgeontalks, and I wanted to talk about what to expect from your vision after having an eye operation. So, you think you're having eye surgery, which should be making your vision better. Actually, in the early post-operative period, often the vision is a little bit worse than it was before. And this can be a shock and people can get worried. But I like to reassure my patients that this is quite normal. During any eye operation, we produce some inflammation, which needs to settle down. The front window of the eye, the cornea, can sometimes get cloudy, and this also needs to settle. And looking through that in the early stages after surgery can be a little bit like looking through frosted glass, so the vision may not be perfectly clear. And all of these things mean that the vision after having, for example, a cataract operation, you can take a few days to normalize. If your cataract was very big and dense, of course, you may notice an improvement straight away. Also, after having a retinal operation, for example, a retinal detachment operation, or surgery for a macular hole or an epiretinal membrane, you will have no vision in the eye after surgery, or minimal vision. You may be able to perceive some movement and shapes, but really not more than that. And the reason for that is because we leave a special gas or air bubble inside the eye, which stops you focusing. And people get very concerned about this, and we should warn everybody before the operation that this will happen, but sometimes we do forget. So don't worry if after your retinal operation you can see very little. Over the space of a few days or weeks, you will begin to get your vision back, which will come in from the top, and the bottom will get gradually less blurred. There's often a black line and a wobbly shape in the vision, which is your gas bubble, as it gradually shrinks and disappears. Always it's important after having an operation to keep an eye on things, and if the vision is blurred immediately, this is not a concern, but if the vision gets progressively more blurred over the initial few days after surgery, especially if you also have pain, and this is something to flag up urgently with your operating team. The vision should be gradually clearing, especially with the drops that you've been given to settle the eye down, and just with time. But any worsening should be a red flag to be investigated.